If you're watching this video, then most likely you have an issue with your breast implants being too close to the middle of your chest. So there are a couple of reasons why this can happen, and we'll talk about the reasons as well as your potential treatment options. So basically, everybody has a different width of their sternum. And the muscles of our chest, the pectoralis muscles, will attach in different locations based on the person. And there's some people where those muscles and therefore the breasts attach very close to the middle of the sternum. In those situations, you can have breasts that look like they're very close together, like in this patient. In other situations, however, sometimes the muscles attach off to the side of the sternum or the breastbone, and you have breasts that appear to be a bit separated. That also can be very, very normal. Well, you can't necessarily convert somebody with breasts that are separated into somebody with breasts that are right next to each other in the middle. And you can't necessarily do the opposite too. So usually I tell patients is if you're having a breast augmentation, you're going to end up like you do now, just bigger. And so if your breasts are very close to the middle right now and you have a breast augmentation, then it will likely be that way afterwards. If, however, your breasts are fairly separated right now and you have a breast augmentation, then most likely it will be like that afterwards as well. So the first thing to remember if you're having your breast implant surgery is if you've got a space there before, it'll be there afterwards. If you don't, basically it shouldn't. So what happens when this becomes a problem? Well, if you have implants that are put under the muscle and your muscles attach very close to the middle of your breastbone, then it might look like they may be too close together, but it's just the way your anatomy is. So like in this patient, her breast, she has very little space between her breasts, but it's very normal because this is how she's built. However, there can be situations when the dissection is overdone. And if they're under the muscle, the doctor can, and it's very rare, but they can cut through those muscle fibers too far, causing the implant to go too far to the middle. In extreme cases, if they cut through both sides of the muscle, you can actually get a connection between the two implants. And there are stories of people having implants go literally from one breast actually to the other. Extremely rare, but can happen. Now, this is very unlikely if you're under the muscle because the doctor will need to cut through a lot of muscle to do that. And once again, not all that common. However, if you're above the muscle, then you don't have that muscle that's an issue. And so if you start off with breasts that are close to the middle and implants are put above the muscle, then that surgeon has to be very careful not to over dissect towards the middle because once again, this could be a much easier problem to create. So in those situations where they're too close to the middle, either that's the way you started with, it's just the way you are, or it's likely a surgical mistake or something on that end. And so take a peek at your before pictures, and if your before pictures show your breasts very close together, then it's probably just the way you are. So how do you treat it? Well, if it is done by over-aggressive dissection, typically you have to do two things to ideally prevent it from recurring, okay? A capsulorrhaphy is a surgery where we alter the capsule or the scar tissue of the breast. And what we can do by altering the scar tissue is that we can close off a portion of the scar tissue that has been dissected too far towards the middle, and we can make it so that the pocket only goes up to a certain area, and so you have a new separation. The problem with just doing a capsulorrhaphy, meaning just suturing that capsule together or cutting it and closing off the old one and making a new one, is that it may not be strong enough to withstand the pressure of the implant. And so there is a fairly high rate, depending on the situation, of this type of surgery failing. And so because of that, the majority of times that I treat this type of symastia issue is we do two things. We do the capsulorrhaphy, meaning we close off that part of the pocket that has gone too far towards the middle. But on top of that, we put something over it to provide support so that it doesn't recur. And typically that something is something like Stratus. Now, Stratus is radiated pig skin that basically is radiated so there's no cells in it, and it can act as kind of a scaffolding inside the breast. Basically, it grows into the tissues of your breast and it adds extra support. Now, the good thing about Stratus is that it's typically well tolerated and it's very strong to provide support to hopefully prevent that implant from going too far towards the middle ever again. But the bad thing about Stratus is it does take time to put the Stratus in, and Stratus can be very expensive. It can cost in the several thousands of dollars just for the actual product. But if you've got a true symastia issue, if your breast implants are way too close together, then this would definitely be the way to treat it. Now, the surgery itself is done under a general anesthetic. We would typically go through your old scar, either below your breast or around your areola. We would take the implants out, do that capsulorrhaphy, meaning we would close the middle portion of the breast pocket, and then suture in that stratus as, once again, the support over it. The surgery, if it's done on both sides, which usually it is, can take anywhere from probably 2 to 3 hours. And then afterwards, there is a little drainage tube on both sides. Those come out usually within a few days to a week at the longest. It's not a real painful surgery. You may take a handful of pain pills the first day or two, and that's usually about it. And you should see the results right away. Now, in these situations, what I'll do is we'll actually have you wear a special bra with padding on it that can help prevent this from recurring. And that's something that we can talk about during a consultation. You have to avoid exercising for about 3 weeks, and then really avoid exercising the muscles of your chest for a few months to really allow that to heal. Because the last thing you want is to go through all of this and have it not work. As far as the risks, there's always risks of bleeding and infection. The first thing I always start talking about with surgery. There's risks of capsular contracture. Your breast tissue may react differently towards the implant when it's put back in than it did before. So you can get excess scar tissue. Well, if you didn't have it before, it's pretty unlikely. And obviously there's the risk that this can recur, that the symastia can come back. However, if it's done appropriately and you use the extra scaffolding, the stratus, the chances of it coming back are pretty small. And so usually people do really well with this, but it is a pretty rare issue. It has a definite defined treatment for it, however. So if symastia is your problem, I encourage you, come in for a face-to-face consultation. Definitely bring your old implant and your old operative information with you, because that's going to be super important to help us plan your surgery. So dig up your information you have at home, call the previous doctor, get those medical records before you come in for the face-to-face consultation. If they don't have it, if you don't have it, then call the operative center where you had the surgery at and see if they may have a copy. I can see you if you don't have any of that information, but it just makes the consultation less helpful for you, and it makes the surgery planning much more difficult for the two of us. So if you can get that information, definitely bring it in with you. Well, thank you for watching. If you've got symastia, we do have good treatments for it. It does involve surgery, but typically those treatments are pretty successful. Thank you for watching.